randomized study for adults with 1 to 3 brain metastases that were not resected, and the tumors had to be 3 centimeters or less in size. Patients had to have controlled systemic disease, and they were stratified based on whether that was controlled for 3 months or less or more. The patients were randomized to receive either stereotactic radiation to the lesions or stereotactic radiosurgery followed by whole brain radiotherapy. And there were 213 patients randomized over that 10-year period. About 5 of them dropped out, but this was an intent to treat analysis. So there were several upshots of this trial. We know that whole brain radiotherapy can decrease the risk of recurrence outside the stereotactic area by about 20%. We know that, but we also know that there is also, with whole brain radiotherapy, a decreased risk of relapse at the primary site by about 20%. But against that is the concern that the tumors, if you don't do the whole brain radiotherapy, the tumors are going to recur, and that's going to produce the neurocognitive decline. And they presented various trials showing that there have been controversies and conflicting data with respect to that, with some trials showing that if you control the brain tumors, they don't deteriorate as fast, others showing they deteriorate anyway. So the results of this trial, basically it was designed, the primary endpoint was to measure their cognitive function at 3 months and see who was doing better, and it was powered to determine whether the stereotactic radiosurgery patients without whole brain had 25% less deterioration in their neurocognitive testing at 3 months. And they employed 5 different tests of neurocognitive function, which are common in a panel that's being used for several trials, and 2 quality of life instruments, and they looked at that. They measured these at different time points, 6 weeks, 3 months, 6, 9, and 12 months, but the endpoint was for the 3-month phase. What they found in a nutshell was that the patients who received the whole brain radiotherapy did deteriorate faster, and at 3 months, 90% of them had declined according to the study standard versus 60% who did not receive the whole brain. And it was defined as falling 1 standard deviation on at least one of the neurocognitive tests. That's how decline was defined. They also went on to show that primarily the problem was in short and long-term memory testing, and also in language fluency, which is important because that's a quality of life measure.